Yeah, I'm okay. I think.
Hi everyone, we are Group 3 and we are discussing Imogen King's theory. The members of the group are Melanie, Christina, Mary, Jeffrey, and me, Elsaline.
Okay, I'm going to discuss getting to know Imogen King. Imogen King, born on January 1923 in West Point, Iowa. She's youngest of the three children. In 1945, she received nursing diploma from St. John Hospital School of Nursing in St. Louis, Missouri. She received her BSN in Nursing Education in 1948. She acquired Master of Science in Nursing also from St. Louis University in 1957. In 1961, she earned Doctoral of Education degree from Teachers College, Columbia University in New York City. She spent in the academic setting of Ohio State University, Loyola University, and the University of South Florida in 1966 and 1968. She has received Jesse Scott Award from Leadership and Honorary Doctor of Science in 1996. And she died in December 24, 2007, and 2 days after, she's suffering from stroke. So,
Good evening, everyone. The Imogen King's of goal attainment theory was first introduced in the 1960s. Her theory deals with a nurse-client dialogue, a relationship to which each person brings personal perceptions of self, role, and personal levels of growth and development. The nurse and client communicate information, first in interaction and then in transaction, to attain mutually set goals. The relationship takes place in a space identified by their behavior and occur in forward-moving time. Imogen King's major concepts. There are three interacting systems in the theory of goal attainment according to King. These are the personal system, interpersonal system, and the social system. Each system is given different concepts. The concepts for the personal systems are perception, self, growth, development, body image, space, and time. These are fundamentals in understanding human being because this refers to how the nurse views and integrates self-based from personal goals and beliefs. Among all these concepts, the most important is perception because it influences behavior. King summarized the connections among these concepts as an individual perceptions of self, of body image, of time, and of space influences the way he or she responds to objects and events in his or her life. The concepts for the interpersonal systems are interaction, communication, transaction, role, and stress. This shows how the nurse interrelates with a co-worker or patient, particularly in a nurse-patient relationship. Communication between the nurse and patient can be verbal or nonverbal. Collaboration between the patient and nurse is very important for the attainment of their goals. The concepts for the social system are organization, authority, power, status, and decision making. This shows how the nurse interacts with co-workers, superiors, and subordinates, and the client environment in general. These are groups of people within the community or society that share common goals, values, and interests. It provides a framework for social interaction and relationship and establishes rules of behavior and courses of action. Among the three systems, the conceptual framework of interpersonal system had the greatest influence on the development of her theory. She stated that although personal systems and social systems influence quality of care, the major elements in a theory of goal attainment are discovered in the interpersonal systems in which two people who are usually strangers come together in the healthcare organization to help and to be helped to maintain a state of health and that permits functioning in roles. And fundamental ideas. Fundamental ideas just help the patient achieve his or her goals for getting healthy and help patients maintain their health. Incorporate the idea that human beings are open systems interacting with their environment. And the last one, adjust to life and healthcare influenced by individuals' interaction between environment. By using the nursing process described in the Imogen King's theory, a nurse can be more effective in working with a patient to achieve their goals and can truly help patients.
For the case scenario, we have Mrs. Jones. She's 50 years old, currently working as a personal support worker. She is divorced and her teenage daughter lives with her. She has type 2 diabetes and is being treated for it since the age of 26. She would oftentimes do last-minute cancellation and rescheduling of her follow-up appointment with her nephrologist due to her hectic working schedule and lack of health awareness. Years passed and her nephrologist started to observe manifestations of progressive kidney disease. Mrs. Jones was advised that hemodialysis is needed and arteriovenous fistula was created in preparation for the said procedure. She mentioned with her doctor that most of the times she finds it difficult to concentrate, lose interest with food, and has trouble falling asleep. She also mentioned about decreased inactivity tolerance due to fatigue and shortness of breath. For the client assessment, subjective data. Mrs. Jones has history of type 2 diabetes, loss of appetite, difficulty or inability to concentrate, insomnia, easy fatigability, and shortness of breath. For the laboratory findings, the ones in open and closed parentheses are the normal values. Her BON is very high, it's 47 millimole per liter. Potassium is high, 7 millimole per liter. Hematocrit is low, 20%. Creatinine clearance is low as well, 10 ml per minute. And serum creatinine is very high, which is 1,140 micromole per liter. For the chest x-ray, it indicates pulmonary edema.
Okay, for the client goals, we come up with client will able to manage herself and to prevent further complication. Second, the ability to perform activity of daily living without shortness of breath and easy fatigability and ability to concentrate. And the last one, client will gain knowledge about the disease process and the importance of compliance to the treatment.
Everyone, my name is Jeffrey. So based on the client assessment that we did with Mrs. Jones, we come up with the following nursing interventions. So for the first one, we assess for the presence of nausea, vomiting, and anorexia. Also, we have to monitor the food intake and body weight changes, monitor laboratory data, serum proteins, fats, potassium, and sodium, because the patient or Mrs. Jones is having problems with intake of food. And the next one is to provide appropriate foods and dietary modification, which is recommended as client favorite. And also evaluate the need for additional help at home, have the patient perform the activity more slowly in a longer time with more rest or pauses, or with assistance if necessary. Next one is to gradually increase activity with active range of motion, exercises in bed, increasing to sitting and then standing. Next one, we also have to review the disease process and prognosis and future expectations so that Mrs. Jones will get a glimpse of the consequences of not not going to her usual appointment. And next one is to identify signs and symptoms requiring immediate medical evaluation, low-grade fever and chills, changes in characteristics of urine and sputum, tissue swelling and drainage, and also oral ulceration. So these are the most important signs and symptoms that she needs to take note of. And also, she has to consider what is important for her. For the rationale of our nursing intervention, our group was able to come up with the nursing interventions appropriate for our patient, Mrs. Jones, based on Imogen King's theory of goal attainment. According to King, the patient is a social being who has three fundamental needs: the need for health information, the need for care that seeks to prevent illness, and the need for care when the patient is unable to help him or herself. Providing information to Mrs. Jones regarding her disease process and prognosis will let her understand the importance of follow-up appointments that she has been canceling. Second is nutrition. Nutrition also has to be addressed for Mrs. Jones due to her loss of interest with food. King's theory states that the focus of nursing is the care of human being or a patient. A patient has physiologic needs, which include food, water, oxygen, and shelter. They need to be met in order to maintain normal body functions. Overall, Mrs. Jones has to collaborate with the nurse. Along the way, both the nurse and the patient would develop interpersonal relationship and share information about their perception regarding Mrs. Jones's situation. Together, they will identify goals and factors affecting the attainment of goals. The nurse's function is to interpret the information gathered during the assessment phase and create a plan using the nursing process to achieve Mrs. Jones's goals.
For the evaluation, after giving nursing intervention, client will be able to manage herself and eat balanced diet according to formulated dietary plan and hemodynamic status. Second, at the end of the day, patient will be able to perform activity of daily living without compromise. And the last one, client will express desire to learn and demonstrate understanding. And
For our conclusion, Imogen King have contributed to the advancement of nursing science through her conceptual system and middle range goal attainment theory. It has been used in clinical practice wherein there is a direct relationship. Through communication, nurses will be able to assess the problems and issues of client, and that they will be able to suggest approaches as well on how to deal with the problem. Another development of King is the goal-oriented nursing record, or they called it GONR. GONR is a method of collecting data, problem identification, implementation, and evaluation of care, along with the theory of goal attainment, have been proven effective in the delivery of safe, efficient, quality nursing care. Interestingly, her theory have been implemented in various clinical and administrative practice internationally and garnered positive feedbacks. We believe that her approach is very useful and valuable up to these days and in the future. Therefore, the use of King's theory in our daily practice, nurses are assured of excellent performance in their career. Okay, that ends our presentation. Thank you, and I hope you'll find it informative. God bless us all.